Hello friends. So today we'll discuss about some conditions that could present with visual symptoms. Means they have problems related to vision, but the underlying cause can be neurological. So today I will discuss five more important conditions. So the first one is something called as Amaurosis fugax. So in this, what happens is the person has a sudden onset loss of vision, usually in one eye and sometimes both the eyes, and it is without any kind of pain. And the best thing is that the vision improves after a few minutes. But one should not ignore it because this condition, what is called as amaurosis fugax, it occurs due to lack of blood flow to the retina, the blood vessel supplying blood to the retina, and it could also mean that the person has a higher risk of less blood flow to brain, which can cause stroke in the future. So this is the first one. The second one is when a person has a sudden loss of vision on one half the visual field. So either right side or the left side, and it happens all of a sudden. And in this condition, the person may be sometimes not aware of it, and that is called as cortical blindness. And when the eye doctor examines the eyes are totally normal, but the person still cannot see. So this usually happens due to stroke affecting the occipital lobe, which is supplied by the artery called as posterior cerebral artery. So sudden onset of loss of vision on one half could mean that the person has already suffered a stroke. The third condition is where the person has a sudden onset loss of vision in one eye or sometimes both the eyes. It can happen all of a sudden, or it can start and get worse over the few days, say 3 to 4 days. And again, there is no pain, but sometimes little bit pain may be there on moving the eyes. So this could happen because of a condition what we call optic neuritis, which could indicate a demyelinating illness such as multiple sclerosis. Then the fourth condition I would like to discuss is where the person has sudden onset visual symptoms on one half the visual field usually, and sometimes both the sides, where they see zigzag lines, flashes of light, sometimes stars, and this could last for several minutes. And after that, the person has severe headache, which can go on for more than 4 hours or several hours. So that usually indicates a condition called visual aura, which can occur in people with migraine. And the last or the fifth condition I want to discuss is where the person could have drooping of eyelid on one side, what is called as ptosis, and double vision. So one object is seen at 2:2, and these symptoms are typically worse in the evenings. So they may not have these symptoms when they wake up in the morning, and then also there could be periods when these symptoms are not there. So this kind of ptosis or diplopia usually indicates a condition called as ocular myasthenia gravis. So I have listed here five common conditions where the person can have mainly eye-related symptoms, but the underlying cause is neurological. And so when you notice any of these symptoms, or if you have a family member or friend who has these symptoms, please consult a neurologist as soon as possible, because with proper diagnosis and early treatment, the outcomes are excellent. Whereas if we delay treatment in many of these conditions, then it can lead to long-lasting complications. I hope you found it useful. Please like and share. If you have any further comments or queries, I'd be happy to answer. Have a good day.